Hi, I'm Bob Schrupp, physical therapist,
Oh, Brad Heineck, physical
and
therapist.
together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, we get a lot of questions. People want to know if they have a herniated disc or not. Herniated disc, slip disc, prolapsed disc. There's all these different names for it. Basically, the disc comes out, where it should be, and it's pushing on a nerve. So we're going to show you 3 quick tests. Now, this isn't making you a doctor, and this isn't something you're going to want to rely upon. But it is something that maybe you can, it might prompt you then to go to your doctor if you're having some of these signs are positive and some of the symptoms are, that we'll mention at the end of the video.
Right.
So just 3 quick tests. These are tests the doctor may do with you. The first one for certain they'll do with you. Why don't you go ahead and lay down, Brad?
Sure. I'm ready for a nap.
This is a straight leg raise. This is probably the gold standard for a herniated disc, and it's best if you do have somebody else that can help you do this. You could try it on your own. We're going to say that Brad's getting pain on the left side, on the left leg, down the left leg. So what you're going to do, keeping the leg straight, toe pointed straight up, I'm just going to bring the leg up like this. And for a lot of the patients I've had that have had a herniated disc, this starts bringing it on right away. Yeah, somewhere in this range, they'll start getting the pain right away. And what you can even do is back off a little bit till the pain is off, and then have him push your toe toward him, toward his chin. And if that brings it on again, not just stretching pain, but that pain that you've been feeling down the leg, that's a pretty positive sign that you're getting sciatic nerve pain. That's, the herniated disc is pushing on the nerve and causing pain down the leg.
Right.
So this is the #1 test that people do to see if they have a herniated disc.
And also, Bob, if I can talk.
Sure.
A lot of times the pain will be up in the back. You'll do that and say, I feel pain in the buttock or up in the low back, and that's even more positive because you're not stretching any tissues
Very good point.
up in the back, so.
When you're allowed to talk, you say good things. The other thing is it could cause pain in the back, and it could also cause the pain going all the way down the
Sure,
leg too.
yeah.
So, all right, the second one, Brad, and this is just a quick test too. Go ahead and stand up. Well, you'll see a lot of doctors are going to have you doing. Lonnie, if you can kind of pan down, Brad's going to show you what we have patients do. And this is checking for weakness or even sometimes pain with this.
Right. So forgive the floor, we're getting our new floors in a couple of months, so just put up with the checkers. Okay, so they'll have you do this. Walk on your heels, they'll say. A doctor or a therapist, I do this a lot with my patients, or walk on your toes. Now if you find that on one leg you can do this and the other leg that doesn't, that would be a positive. You're unable to pull that toe up like that, that's a positive sign.
Or if you can't stay on your toes.
Yeah, or it might be like this and you're doing that.
Or you might be having pain with that.
Come back up here, Lonnie.
Lonnie, find us. Yeah, if you're having pain with that. Now, this could be other things too,
Right.
but just another possibility that it's a herniated disc. The third one is a seated test, Brad. Seated or slump test. I wonder if this might be better off to the side even.
Sure. Let's bring it this way.
Okay. Well, we slump
there.
at the end here. Okay. Ooh.
Be careful, Bob.
So anyway, what you're going to do is you're going to go ahead and slump.
Round the back of it.
I'm sitting on my sacrum, as they call it. So now, right in this position, now you're going to go ahead and straighten the leg and pull the toe toward you.
Right here.
And it's kind of like the same as the straight leg rest test. And if you start getting pain up in the back or pain all the way down the leg, it's that's somewhat positive. If you even do this, bring the head down, and it gets worse,
Right.
that's even more of a sign that it might be somewhere along your spinal cord on the dura.
Right.
It's getting pushed and there's getting some pain, so it may be a herniated disc.
Right.
So those are the 3 quick tests, Brad. Why don't we talk about some of the things that you're typically going to feel when you have a herniated disc? Some of the symptoms.
Sure. Classic symptom #1, you're going to have pain, numbness, and tingling sensations below the knee down to the foot.
A lot of times you can get pain going down the back of your leg to the knee, and it's not necessarily a herniated disc. There's a lot of other back problems that'll give you pain that far.
Right.
But once you start going below the knee, that's a pretty good sign you've got sciatica or a herniated disc.
Sure.
The other thing is typically it is on one side, Brad. It's very unusual to go down both legs. If someone says it's going down both legs, I'm thinking spinal stenosis, or I'm thinking something else that is not typical at all, unusual. So it's typically down one leg.
Sure.
We talked about the pins and needles and numbness, pain. Also, you're gonna have weakness quite often, and that's why we already did that one test. If you feel like the leg is weak,
It's gonna be uncomfortable typically to sit longer time periods. Bending over is very uncomfortable, and there also may be a shift. You may see the person
shifted away,
like
generally
this.
away from the pain.
So yeah, the right leg will have the symptoms, and their back will be away from that, and they walk like this. I was just in that situation a few months back with a flare-up.
Okay, and the final thing, and people ask you this, are you having increased pain when you cough, or when you sneeze, or when you bear down when you're going to the bathroom?
Sure.
So they also ask if you're having trouble with your bowel and bladder, but that's kind of a specific, huge problem with the cauda equina. But
Right, we have a video on that.
we have a
too.
video on that. So those are some of the things, some of the quick tests, some of the questions you should ask yourself. Obviously, you need to see your doctor if these things are going on. But we thought, give you a little more knowledge and see what you can do with it.
You better believe it. So remember, subscribe to us, and we are not professional actors, but we are professional therapists, and we can help you out from here until you're 102 years old.
That's right.
After
We'll be
102,
with you.
it's not so
You're
good.
on your own.
Yeah, after 102, it's
Yeah, we can't help you anymore.
Yep, that's it.